HRT won't work for everybody. It's something that often people will have to trial and error with their doctors. The reason why HRT doesn't work for everybody is because everybody synthesizes hormones differently. It will depend on their age, sometimes even their cultural backgrounds, ethnic backgrounds, the way they metabolize through the liver, whether they've had a history of cancers, blood clot diseases, cardiovascular diseases. All those things will actually change whether somebody has a good response to HRT or not. Depending on the method of delivery, that can sometimes change how the woman's body can also respond to HRT. Unfortunately, HRT can come with a lot of side effects, like a lot of medications. It gets absorbed systemically, so that there's a lot of those changes. And sometimes it gets worse before it gets better. And then some women are very lucky for it to work very quickly and actively for them. HRT is usually used as a short to medium term treatment option under the care of a healthcare provider. What a natural approach will give you is a long-term result. So we look at it through a lens of overall wellness and prevention, as well as treating acute symptoms. So, the first line of attack is always going to be treating the acute symptoms. We've had a lot of patients that have come in either unsure about going into HRT or are already on HRT that are essentially not loving the effects of HRT, or maybe just educating themselves and trying to find a different way of replacing what they're already doing with their doctors. I'm all about teaching the patient and giving them the tools and the knowledge to understand their bodies. If they understand their bodies and what's happening with their bodies, they can ask the right questions. Regardless of whether they come in and have natural treatment or HRT, it is important to know what's happening to your body. It's important. With that, you can ask the right questions, you can advocate for your own health, you can advocate for your own wellness. Chinese medicine, I am very big on equipping the patient with those knowledge and those tools to then move through that change of life smoothly. By not replacing estrogen through HRT, you are not doing damage to yourself. The decline in estrogen is a natural thing to happen through the body. In traditional Chinese medicine, we view menopause, the decline of estrogen and progesterone through the decline of follicles in your ovaries, as something your body is supposed to go through. While HRT has its place, it can help a lot with changing the acute symptoms very quickly, like hot flashes and night sweats and vaginal dryness and mood changes. Using traditional Chinese medicine to get yourself through that natural change in life is not doing damage to yourself. In Chinese medicine, we don't want to stop the natural decline of estrogen. We are more focused on helping the body have the right tools to then self-regulate the hormonal changes that are happening through that stage in your life.